Thank you for joining us today. I'm Dr. Seemal Desai. I'm a board-certified dermatologist in private and academic practice in Dallas, Texas, and I am the president of the Global Vitiligo Foundation, and I am here with my dear friend and fellow pigment expert, but pigment expert extraordinaire, Dr. Pearl Grimes, who's the founder and medical director of the Vitiligo and Pigmentation Institute of Southern California in Los Angeles, and the immediate past president of the Global Vitiligo Foundation. And I have to say that because we are both here together working in tandem for the future of this devastating disease. So Pearl, we're here to debunk myths. And I'm really happy we get to spend a few minutes talking about myths in vitiligo, because we see patients every single day who come in with a lot of misinformation. So if I had to start and ask you, what is the number one myth that you want to debunk about vitiligo?
Okay. But first and foremost, I am so excited and honored to sit with you today as we bust some myths.
We are busting them.
So I think the key myth is, I'm so tired and frustrated, Seemal, that we're still addressing the myth that vitiligo is a cosmetic condition when we've had data for years and years and years that it is a classic autoimmune disease associated with other autoimmune comorbidities.
Vitiligo is not a condition. It is a disease. And I think we have to be very intentional about using those words. Our patients need to be heard. They need to know they have a disease. That disease is now on the cusp of breakthroughs in its treatment paradigms. I am confident, I know you are too, that one day we will have a cure. I don't know when it will be, but we will hopefully have a cure for this someday. We're not there yet.
I agree with you. I think we will have a cure, but the exciting thing of where we are in 2025, we're at that watershed, pivotal time.
Absolutely.
Where we have multiple new treatments that are in the pipeline and others that will soon be approved for use in the dermatologic and medical arena at large.
So you're going to hopefully feel this passion that we have, this energy, and frankly a little bit of angst also, because Pearl and I do this in our practices every single day. But myths abound in this disease, especially when you look at social media, Instagram, TikTok, online. There's advice out there from non-dermatologists, not vitiligo experts, and we want to make sure we set the record straight on a few other things. So the other myth I wanted us to debunk was to talk a little bit about food, because I get a lot of questions. Oh, if I change my diet, I know my vitiligo is going to get worse or better. What is the myth that we want to debunk about diet?
Okay. I think the myth to be debunked about diet is, it's my gut.
Yes.
Okay, I have leaky gut. It is, I'm just eating the wrong way. I'm taking in the wrong foods. Is there a specific vitiligo diet?
Right.
There is no specific vitiligo diet. My approach, Seemal, is to make general, what I call healthy dietary recommendations. If you're taking in lots of preservatives, get rid of them. Increase your content of fruits and vegetables. And interestingly, my typical recommendation for a diet is a Mediterranean diet.
Okay,
which
I
is
love
my
that.
favorite.
Yeah,
okay, and I think across the board, most in the healthcare arena would agree that a Mediterranean diet is a healthy diet.
I like that, and I've also similarly said the same thing for my patients. We see a lot of patients who say, oh, well, I read that citrus will make this worse. So I think the myth, to your point, is we have no data to say there is a dietary link, good or bad, with vitiligo. But what we can say is that a healthy, balanced diet is an approach, and that's an approach we'd recommend for any autoimmune disease.
Absolutely.
And we need more studies. Okay, we're on a roll, so let's keep going with some more myths. The other one we get a lot of is that even when my disease comes back and gets better, meaning, well, let's put it this way, the pigment gets better. What's the point of me doing treatments? I'm gonna lose it all again anyway. We have patients who come in and say, I heard that since there's no cure, I shouldn't even do these treatments because once you may get my color back, it's all going to go away. True or false?
I think it's false
I agree.
because the way I address it with patients is the myth is you're wasting your time to implement any treatment.
Correct.
And so the reality is this is a condition that can be treated. We can't cure it, but we certainly can treat it. And how do we treat it? It's about stabilization, shutting it down if the disease is spreading, which is so important, repigmentation, bringing the color back, and then adjusting your therapies to maintain it long term. You can't get it and then just say, okay, I'm done. I'll see you in 10 years. Then there's a great likelihood that it will come back.
Right.
But if that patient is willing to be monitored, we work with them to keep it. And if anything is coming back, we get ahead of it.
Absolutely.
To shut it down again.
And so the message is, please do not treat. I know that's a double negative, but don't not treat out of fear that it's just going to relapse, right?
Our job as your caregiver is to be ahead of a relapse and help mitigate the likelihood of that happening. And I think we can be pretty darn effective at that.
So that's what I was going to say. Now we even have techniques where we can prevent relapse. Pulse dosing, twice weekly dosing. I mean, we don't have even time to go into the nuances, but there's lots of tricks that we do to maintain. And guess what? We do maintain. And these patients are happy and they're thriving, especially with head and neck disease.
Where we get our best responses.
So, perfect segue.
I tell my patients, if I fail you on your face and your neck, I take it personal because I know our
100%.
response rates are so high in being able to repigment and moreover being able to maintain it long term.
So a quick funny story to that. I was on a flight recently, and this has happened to you multiple times, I'm sure. On a plane, boarding, someone comes on with very disfiguring facial vitiligo. And it took a lot for me not to slow down the boarding of this flight, to grab this person in the aisle and say, who's your dermatologist? Have them call me. Because you should not have such disfiguring facial vitiligo, because that's the one part of the body we can truly transform their lives. Okay, another myth. The one that I hear also a lot of, oh, why am I just getting a cream? There's no cream that's ever going to work.
That's truly a myth.
That is exactly right. Yes. So that is a myth. Creams can work. In fact, ruxolitinib cream has been a game changer in my practice, I know in your practice. Now, we were both involved in the studies, but the studies were published in the New England Journal of Medicine and have shown an incredible transformational opportunity for our patients. So it's true that patients come in saying, oh, don't just give me a cream, that's not going to work. That is a myth. Topicals do work when used effectively and when you really look at the data. And I'm excited to share, and Pearl, you're a part of this, we're doing studies now in the next phase of our topical journey. And now there's going to be oral therapies, and there's going to be new advances in combination treatment. So there's a lot on the horizon.
The only issue with topicals, two issues. If you have extensive vitiligo, while we always use topicals, I think we probably need to combine them with other treatments, and the most common addition would be narrowband UVB phototherapy. And we know now there are multiple studies showing that even if you just look at narrowband UVB, you get much better responses when you use it in combination with a topical modality, a topical cream.
And in the ruxolitinib studies, this was actually done as monotherapy. So in the ruxolitinib studies when we published the data, patients weren't in phototherapy. And so I guess that leads me to the final myth. There's a lot of misinformation and myths about UV therapy in vitiligo. And one of the myths that I hear a lot, especially being involved in JAK inhibitor research now for many years, is that, oh, the JAK inhibitor is not going to work because you're not willing to do phototherapy. And that's a myth. That is not true. JAK inhibitors can work without phototherapy. We have data they work better in combination, but don't withhold treatment, in my opinion, if a patient is not willing or unable to do phototherapy.
Oh, I agree with you 100%, and I think that is indeed a great myth to bust. If you look at a topical JAK and an oral JAK, we know that given the data from all the clinical trials, they do work as monotherapy.
Right.
Emerging data simply suggests that we can increase that efficacy, improvement, repigmentation substantially by adding phototherapy.
Pearl, this is always incredible. We could talk for the whole rest of the day. We
Absolutely.
could talk for hours on busting myths. But I hope that these tips from Dr. Grimes and myself helps to allay some of the myths and fears that are out there. And our job as pigmentary disease expert, board certified dermatologists, is to make sure that patients and you, our fellow colleague clinicians, are getting the right information to make those visits even more successful. Until next time, thank you again.